Hello everyone, welcome to Tech Sharmit. In this session, we are going to talk about another very important topic of medical coding anatomy, where we will be mainly discussing about the body cavities. Prior to this session, we have covered all the body planes and its type in detailed way. Now we are going to continue with this new topic, that is body cavities. So here, by the end of this session, you will be able to understand what is body cavity, what are the two main types of body cavities, and its subcategories or subtypes for the body cavities. So these things we are going to discuss, and we will proceed in the same way. Firstly, I'll walk you through the definitions and then the meanings of the words that we are using, and also we will see the types that comes under a body cavities. Okay. Along the way, we will also discuss some important points for the interview perspective, the questions, the tricks, and everything related to body cavities. But before we get started with this session, I would like to recommend you to please go and check out the previously released session first, because they all are in proper sequence and sync. So if you follow it sequentially, then it would be much more easier for you to understand the ongoing topic, because for time being, we are just mainly focusing on body cavities. But prior to that, you should know about other things like body planes and terminologies and directional terms that we have already covered. Okay. And for that, you can also refer the Tech Sharmit digital course book, which is freely available in the description box. There you will find thousands of sessions available in both Hindi as well as English language. So without any language barrier, you can easily consume the content. Okay. And in case if there is any question, you can simply reach out to me through comment section. So I would be more than happy to answer all your questions there. Alright, so let's get started. And before we move into the definition part, let's assume this a diagram. Okay, so that like once you visualize this diagram, it will help you to understand the definitions as well. So mainly body cavities are divided into two parts. One is dorsal cavity and another one is ventral cavity. Ventral cavity and dorsal cavity. Inside it divides subcategorized, like for dorsal cavity we have cranial cavity, spinal cavity. For ventral cavity we have thoracic cavity, abdominal cavity, pelvic cavity, and pelvic cavity. So this is how the cavities are distributed among the body. Now I'll tell you the definition. Okay, so at that time you can visualize this diagram so that you can easily understand. So the definition says body cavities are a hollow space within the body that contains, protect, and support the internal organ viscera. Okay, that means it is nothing but a hollow space where we contain some organs, protect that organ, support that internal organs. So in simple word, you can say the human body is not solid throughout. It has specific internal spaces where organs are housed and protected. These spaces are called body cavities. Okay, so this is just a space where we have housed and protected the organs. Clear? Now this thing is clear, like what is body cavity, but why do we need, why do body cavities exist? So body cavities are serve several important purposes like protection, support, compartmentalization, allows organ movement, allows organ growth and change. So let's see one by one how it helps. So for the protection, like the walls of cavities like bones and muscles protect the delicate organ inside from the external injury. Okay, so for any external injury we use this body cavities. Now to prevent the external injury. Okay, now we have support. Cavities hold organ in their correct position. Okay, so it help us to help body to hold the organs in a particular position. Next is compartmentalization. So in case of compartmentalization, separating organs into different compartments prevents the spread of infection from one region to another region. Okay, so let's say there is a one organ which is infected by some disease, right? Now if it is infected, it might also infect other organ, and that's where the body cavity plays a vital role. So what it basically does, like it simply separate every cavity with compartments so that infection won't go from one organ to another organ. Clear? Next is allow organ movement. Organs inside cavities can move slightly. Example, lungs expand during the breathing and heartbeats without disturbing surrounding structure. Okay, so if we have cavities, it won't impact the surroundings of the structure. Next is allow organ growth and change. Organs like stomach and urinary bladder change inside. The cavity gives them room to do so. Okay, so these are the all benefits that are provided by the body cavities. So I think now you have idea why it is so important. Now we will see what are the two major body cavities division. The first is dorsal, which is posterior body cavity, and ventral, that is anterior body cavity. Now I am assuming you already know the answer meaning of this dorsal, posterior, ventral, anterior, because these are the things that we have already covered, right? So if you have watched those sessions, then you can easily understand it, right? Otherwise might be it would be difficult for you. Okay, so here I have noted down like for dorsal, located on the back side of the body, ventral located on the front side of the body. So these two major cavities are then further divided into smaller cavities, each containing specific organ. That is true, right? So let's see how it subcategorized. So for dorsal cavity, we have two things: cranial cavity and vertebral spinal cavity. For ventral cavity, we have two things: thoracic cavity, which includes pleural cavity and pericardial cavity, mediastinum, right? Then we have pelvic cavity, abdominal cavity, and pelvic cavity. Clear? So this is ventral cavity. Now if you have to compare all the types and subtypes with the content that they hold, so you can see like initial two is for dorsal, so cranial cavity, which is for brain; vertebral spinal cavity, spinal cord. Then the bottom all are ventral. So in case of right pleural cavity, right lung; in case of ventral cavity, left pleural cavity, left lung; pericardial cavity, heart; mediastinum, heart, trachea, esophagus, major vessel, thymus; and for abdominal cavity, stomach, intestine, liver, gallbladder, spleen, kidneys, pancreas; and for the pelvic cavity, bladder, rectum, reproductive organs. So this is how you can consider the cavities with their subcavities and content. Clear? Now let's see how it is utilized in medical coding. So in medical coding, like although there are so many terms, but if you have to compare with few of the terms, so you can see the first example, say thoracentesis. Thoracentesis means procedure to drain the fluid from the pleural cavity, coded by the approach and laterality. Okay, so here it is utilized. Then pericardiocentesis, which include procedure to drain fluid from the pericardial cavity, coded specifically. Then next we have peritonitis, which is the inflammation of peritoneal cavity lining, specific ICD-10 codes based on cause. And then we have laparotomy, surgical opening of the abdominal cavity, specific CPT code. So this is how it is utilized in medical terminology. Now you have learned so many things. So here I have noted down one memory tip for you so that you can recall it in timely manner. So think of the body like a house with different room. Okay, so just imagine like our body is a house where we have separate room. The dorsal cavity is the back room of the house, where brain and spinal cord are protected. The ventral cavity is front room of the house, like all vital organs are here. The diaphragm, the floor separating the upstairs like thoracic from the downstairs abdominal, pelvic. Each room cavity has specific furniture, that is organs, that belongs there. Okay, so that compartmentalization is nothing but a room, and the furniture are organ. So if you think in this way, I think it will help you to recall the topic during your interviews and exam. Clear? Now this topic is done, and in the next session we will talk each type in detailed way, okay, as we did for the body planes. So likewise we will go through each and every topic, but before that there is one question for all of you, and today's question is very important. What is axial plane? What is axial plane? I'm sure you already know the answer of this question because we have studied it in detailed way. So please do share your knowledge in the comment section so that those who don't know the answer, they can simply refer it through the comment. But in case if you also don't know the answer, it's completely fine. You can refer the Sharmit digital course book, or you can refer the previous session. There we have already discussed in detailed way. So from there you can find out the answer, and then you can share your knowledge in the comment section. But please do share your knowledge, because once you start commenting on these things, it will give me the instruction that you guys are learning from these sessions, and accordingly I will produce more sessions for this playlist. So according to the number of comments, we will release the remaining sessions here. So yeah, that's all for today. See you in the next session with new topics. So thank you for watching Tech Sharmit.